Okay. So this is my NG checkoff video. This is going to be part 1. There's 3 parts. The first one will be insertion. The second one will be suction and removal. And the third will be the enteral feeding. So to begin, I'm just going to go ahead and verify my orders. Knock, provide for privacy, all of that stuff. So I would knock, provide for privacy, wash my hands, introduce myself. So good afternoon, Mr. Smith. My name's Maddie. I'm going to be inserting an NG tube today. Can you tell me your name and date of birth? John Smith, 12/18/62. All right, perfect. Have you ever had an NG tube before? No. Have you had any recent nasal surgeries or oral surgeries, dental surgeries, a broken nose? No? Okay. So the procedure is simple. It's a little uncomfortable but not painful. We're just going to insert a tube through your nose down to your stomach to relieve some of the pain that you're having. So I'll do a few assessments on you, and before we do that, I'm going to show you all of my materials I have. So I have my chuck, which I'm going to lay across, my tissues, my cup with water for Mr. Smith, my pH tester, graduated cylinder, and catheter tip syringe, my emesis basin, my lubricant, tape, tube, NG tube, Germex, measuring tape, and my gloves. So to begin, I'm going to go ahead and do a respiratory assessment. I'll listen to lung sounds, front to back. They all sound good. I'm going to have him check for the patency on his nose. So can you hold your left nostril and breathe? Your right nostril. They both sound like they'll be okay. I'm gonna lay him flat and do an abdominal assessment where I inspect, and he does look distended and just overall uncomfortable. I'm gonna listen to his bowel sounds. They're hyperactive in all 4 quadrants. And I'm gonna palpate for discomfort, and it's obviously that he's discomfort, so go ahead and set him up. Alright, Mr. Smith, so to begin, I'm just going to go ahead and measure from your nostril to the tip of your ear, all the way down to your xiphoid process, and then go a few inches lower than that, and mark it with some tape. So that I know where to stop. Okay, get my second piece of tape ready. Ready to go. Alright, so I'm going to go ahead and wash my hands again, because this is a clean procedure. Okay, so since it is not a painful procedure, but just a little bit uncomfortable, we're going to come up with a stop sign that if you get too uncomfortable, we can stop and take a break, and that's just going to be to hold your hand up in the air and wave, okay? So go ahead and lubricate the tip of my tubing. And before we begin, I'm just going to explain to you kind of what to do. So you're going to tilt your head back, and I'm going to insert the tube, and once it hits the back of your throat, I'm going to have you tuck your chin and take some sips of water when I tell you to swallow, just to make the whole procedure go a little bit smoother and faster for you and me both. So I'm going to have him sitting up in an upright position, head tilted back. And we're going to go ahead and insert it in your nose. Okay. Alright, now we're going to go ahead and have you tuck your chin and take some few sips of water, okay? So swallow, 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 swallow. Okay. You did great. Okay. So I'm just gonna tape it temporarily to your cheek until I confirm placement. I'm going to check for respiratory distress, which I don't see you having any. I'm going to take my catheter tip syringe and aspirate about 30-ish milliliters of stomach contents and see what we're getting here. Put it in my pH tester. I can tell that we're not in the lungs because it's brownish greenish with a little bit of some coffee ground like substance, so I know we're not in the lungs. And I'm going to go ahead and have x-ray come up and confirm placement, just because that's best nursing practice, and they have confirmed placement. So since they've confirmed placement, we're going to stabilize this to your nose, and you can either do this with a bridle or tape, and today we're just going to use tape. So you're going to take it and you're going to split it like pants and take one side and wrap it around, and take the other and wrap it the opposite way. And then you're also going to secure it to the patient's clothing right here. And that's it for the first video. So you can pause it.